So I'd like to introduce the next speaker, who is Dr. Sarah Linde-Feucht, who is the Chief Public Health Officer for HRSA. She has an extensive background in addressing healthcare disparities and health per se, and she's going to talk about the HRSA National HIV Plan and HCV Plan.
All right. Good evening, everyone. It's an absolute pleasure to be here, and I wanted to convey greetings from Dr. Mary Wakefield, who is the administrator of HRSA. I originally thought I had about 30 minutes or so to give this talk, but I have been, and I've got a packed presentation, but I've been assured that you'll be receiving the slide set at some point after the meeting, or if the video turns out, well, that'll be the shortened presentation. But in any case, you will get all the information, and my contact information is on the last slide. So I'll just apologize in advance if I have to, I will have to shorten the presentation a little bit. But so let me go ahead and begin. You know what, could I ask you, do you mind just advancing the slides for me? I wanted to give you a brief overview of HRSA's mission, programs, and public health priorities, and describe our role in implementing the National HIV/AIDS Strategy, as well as the Viral Hepatitis Action Plan, and then briefly go over challenges and opportunities. I am not as familiar with this crowd as my colleague Kevin is, so I'm going to assume that you all know the HRSA mission, but let me just share it with you. It's improving health and achieving health equity through access to quality services, a skilled health workforce, and innovative programs. And we achieve that mission through our strategic plan. We have 4 broad goals, which are listed on the slides. And many of the sub-goals are very much public health focused. These are just some examples listed here. By no means is this the entire strategic plan, but I put these up here just as examples so you can see how our agency priorities very likely align with your organizational priorities as well. So how do we achieve our mission? Our budget is probably slightly smaller than CDC's, but we do a lot with what we get. It's $9 billion, but we have 80 different grant programs, and we support the health center program, which includes community health centers, migrant health centers, homeless health centers, and public housing centers. Those are 8,100 sites across the country. Obviously, the Ryan White HIV/AIDS program, I don't need to tell you about. We have the maternal and child health program, which largely funds the states and supports their efforts at providing maternal and child health services in the states. Our National Health Service Corps provides scholarships and loan repayments to primary care clinicians, not just physicians, but many other types of primary care providers in return for serving in underserved areas. And our current field strength is over 9,000 providers strong. We also have numerous workforce training programs, and in medicine, dentistry, nursing, public health. We have an Office of Rural Health Policy, which serves as the Federal Office of Rural Health Policy to assist with improving health issues in the rural communities of the country. We oversee organ, tissue, and blood cell donations. We are responsible, we're the federal agency responsible for poison control, and we administer a drug discount program known as the 340B program. So I give you this overview just so that you understand that our agency is, I know many of you or all of you are familiar with the HIV/AIDS Bureau, but we have many other bureaus and offices and are working very hard taking care of the health of what we call the safety net population. So when HRSA's current administrator, Dr. Mary Wakefield, took over the helm of the agency, one of her priorities was to reinvigorate public health at HRSA, and so she established the position in which I currently serve. She obviously is recognized the connectedness of individual, community, national, and really global health. And I know you all recognize that in the work that you do daily. I thought her recognition of this was also reflected very nicely in this quotation by our Assistant Secretary for Health, Dr. Howard Koh. Had I known that the Secretary was going to be immediately on my heels, I would have found a clever quote from her, but anyway, you can attribute this to her if you want. Later, that's fine. She and Dr. Koh work very closely together. So as part of HRSA's public health reinvigoration efforts, through a collaborative process with many, many partners, we determined our public health priority areas, which are shown here. And under each priority are several recommendations. And the next couple of slides will show you paraphrased versions of the recommendations and what we are doing or plan to do in HRSA to implement those recommendations. And I will go through these quickly. Achieving health equity obviously is a cross-cutting theme. It's in our mission statement. It's one of our public health priorities. And we have an Office of Health Equity, which is a cross-cutting office across the agency. They do many, many things, including HRSA's portion of implementing the HHS action plan to reduce racial and ethnic disparities. Sorry about that. Under linking and integrating public health and primary care, there's also a lot going on at HRSA. The specific recommendations that are listed on the slide are very narrowly focused, but our implementation of them is very broad. The one that I really want to mention is the IOM study that was released in March of this year on integration of public health and primary care, which was specifically done to provide recommendations to HRSA and to CDC, how our two agencies could integrate better to improve population health. But what's really exciting about that report is the traction it has had way beyond our two agencies, and really the fields of primary care and public health have adopted these recommendations and are moving forward. And a lot of the work that we're doing within HRSA embodies these principles, and I think our engagement with CDC, not only on HIV and hepatitis, but on many, many other issues, really has done well, well before, but especially since the release of this report. I think I will, just for the sake of time, we'll just gloss, not even talk about the recommendations 4 through 6, 7, 8, 9, 10, and 11. So, but you'll have, okay, so that's it. So those are our public health priorities. Huh? Okay, well, you know, I want to get to more of the meat of things. So anyway, this will be in the slides. If you have questions, I'm happy to give you the slower version of the talk. Anyway, those of you who are familiar with my boss, Dr. Wakefield, you know that I'm speaking slowly compared to her. So I get good practice moving quickly. So I really want to focus on what we're doing as an agency in support of the National HIV/AIDS Strategy. I know you all are very familiar with the broad goals of the strategy. What HRSA is doing in support really falls into 4 big areas. Okay, so my other boss is the Surgeon General, and so I would be remiss if I didn't mention the National Prevention Strategy. I did not mean to gloss over that, but as you can see, there are a lot of strategies that we're working on implementing, not only at HRSA, but you know, across the federal government and all of you. So the Action Plan to End Disparities, the National Prevention Strategy, the HIV/AIDS Strategy, Viral Hepatitis Action Plan. So you know, we look at it as good job security. I guess there are so many strategies, so little time. But the vision, goal, and pillars of the National Prevention Strategy are shown here. And then in addition, there are 7 priority areas in the National Prevention Strategy. And I just want to highlight that reproductive and sexual health in that priority area, both the National HIV/AIDS Strategy and the Viral Hepatitis Action Plan are listed as key documents. So just an acknowledgement that in the federal government, we are not intentionally trying to confuse things. We are trying to integrate all of these strategies. And I am being serious, although I realize that sounded slightly sarcastic as I said it. We really, truly are trying to help. And so our role in support of the National HIV/AIDS Strategy, as I said, 4 broad areas: care and treatment, of course, you all are familiar with, and our HIV/AIDS Bureau works furiously to help you all do that. But we can also kind of classify our activity into 3 other domains: policy, research dissemination and translation, and technical assistance and training. So in the area of policy, I've highlighted on the slide several activities that are going on. We have added language to our funding opportunity announcements, not only the ones that go out through our HIV/AIDS Bureau, but through all of our offices and bureaus that provide grant funding, that program activities should strive to support the 3 primary goals of the National HIV/AIDS Strategy, and they should comply with federally approved guidelines for HIV prevention and treatment. Of course, our grantees from the Ryan White grantees are all expected to have copies of the National HIV/AIDS Strategy and incorporate all the goals into planning, prioritization, needs assessments, and other activities. But in other parts of our agency, in our workforce training programs, for example, that train folks in medical, dental, pharmacy, physician assistant, nursing careers, social work, all of those schools are encouraged to include curricula that targets HIV-specific training. And then I've also listed program assistance letters. Those come out through our Bureau of Primary Health Care, and they review and encourage different CDC guidelines on testing and treatment, and provide all kinds of resources to our grantees. Again, grantees beyond our HIV/AIDS Bureau. Other policy examples include collaborating within our agency, so our HIV/AIDS Bureau and our Bureau of Primary Health Care, which funds the Health Center program, have collaborated to increase access to HIV care and treatment. And so there are a couple duly funded grantees who were awarded over $10 million in supplemental funding to expand services, and this is going to enable over 14,000 HIV-positive patients to be served by the organizations that are receiving this supplemental funding. In addition, this chart shows you how some of the quality improvement efforts in the Bureau of Primary Health Care and the Health Center program work HIV into their quality improvement and specifically integrating HIV care into the primary care services that are provided in the health centers. And they do, the Health Center program does track the outcomes for that, and they've seen a 4% increase in the number of HIV-positive patients who are cared for, and a 13% increase in testing from 2010 to 2011. So I will try to slow down a little bit on this next slide, just because I know this is something that many are thinking about. Our panel has already raised it, that how curious folks are about the implication of the Affordable Care Act, as we call it in the federal government, not Obamacare, but we call it Affordable Care Act. But anyway, 2 different names, same legislation. But what is the effect of the Affordable Care Act on the Ryan White program? So we know about the benefits, health insurance coverage, including preventive services, inpatient care through Medicaid expansion and the private health insurance exchange and health insurance marketplace. Other benefits include the elimination of lifetime limits and annual caps from private insurers. So we understand that, that everybody has got the implications of the Affordable Care Act on their mind, and I'll tell you, we are furiously studying it and thinking about it and engaging stakeholder input about how further implementation of the Affordable Care Act is going to impact the needs of Ryan White clients. and particularly beginning in 2004. So the next slide will show you some of the things that we are doing to better understand some of the future impact. I've highlighted here 2 different studies going on. One to study the eligibility, benefits, and differences between traditional Medicaid, Medicaid expansion, and the health insurance exchanges. This study will also look at variances from state to state and look at gaps in coverage. The results from that study are going to be posted soon on the website of our HIV/AIDS Bureau. And then the other project that I have listed on the slide here is to estimate the future need for HIV services under the Affordable Care Act, and that study is scheduled to be completed in May of next year. One thing that is absolutely positively clear is that, that the grantees are absolutely going to continue to need education and technical assistance to understand and implement other reimbursement systems. One other issue that I know is pressing on everybody's minds is the future of the Ryan White program. And you understand that full implementation of the Affordable Care Act really is not going to eliminate the need for the Ryan White program, and that we anticipate that there will be gaps in coverage and services. In December of 2011, HRSA launched a planning strategy for the future of the program, which includes your engagement. We've had all kinds of listening sessions and comment periods, and there clearly is support for the Ryan White program going forward. And then many issues such as increased focus on continuity of care, retention in care, streamlining wraparound and support services, and how is implementation of the Affordable Care Act going to affect care in different jurisdictions. So we are working with other components of Health and Human Services to determine what changes are needed in the Ryan White program, and so we will keep you posted. So I don't really have any answers. I don't have a crystal ball, and I can say what's going to happen to Ryan White is, but we are studying it, and we know as well as you that the program is vital, as my colleagues have said, and so we understand that. Anyway, I'll leave it at that. I don't have more to say on that. Let me just return, if I can, to other things that HRSA is doing regarding implementation of the HIV/AIDS strategy, research, dissemination, and translation. There were a number of different studies. I actually won't review these in any detail because I'm sure you are more familiar with these probably than I am. But lots of studies going on looking at linkage to care, access to care, retention in care, and particularly targeted towards the populations that Kevin highlighted, the populations where the disparities are most evident. The Minority AIDS Initiative Kevin mentioned, we have a couple studies going on under that initiative, the Clinician Workforce Study, the Ask, Screen, and Intervene study, and then Retention and Re-engagement project. Again, I will forego giving you the descriptions of those, but I'm happy to share details and link you with my colleagues back at the agency who are involved in those. On the training and technical assistance side, no doubt you are all familiar with Target, and we think this is a terrific source of technical assistance and training resources for the Ryan White HIV/AIDS program. Want me to continue? Just a few more minutes. Okay, all right. I'll yield. She's here. Okay. Okay. Sheesh. Okay. Very good. So most people who know me would say it's rare to see me at a loss for words, but you just witnessed me at a loss for words. So continuing on, I know you all, on the training and technical assistance side, you're all very familiar with the AIDS education training centers. The next, actually 2 slides from what is showing now shows some of the collaborative and innovative projects going on within some of those centers, including capacity development for healthcare providers who are serving American Indians and Alaska Natives. The US-Mexico Border Training Initiative focuses on providers in the border states, treating the highly impacted subpopulations, including rural substance abusers, duly diagnosed patients, and men who have sex with men. Some of the newer AIDS Education Training Center programs, I think we're actually on the next slide, include expanding existing primary care residency programs to include a focus on HIV training, and also those that include telehealth technology. And we have some very nice collaborations with our partners at University of New Mexico on telehealth with viral hepatitis as well. So speaking of the National Viral Hepatitis Action Plan, I just want to say a few words about what HRSA is doing in support of this action plan. Unlike CDC, we do not have a bureau that is totally devoted to hepatitis, but this is an issue, again, that we work on across HRSA, which is why I wanted to provide you the overview of all the different bureaus and offices that we have at the beginning of the presentation, just so you understand. The bulk of the work on viral hepatitis is done in our HIV/AIDS Bureau and our Bureau of Primary Health Care, which funds the Health Center program. But again, we have the National Health Service Corps, 9,000 strong in field strength. They are a great resource to share information in the curricula. So our role in support of the Viral Hepatitis Action Plan, actually I'll just ask if you back up 1 slide, please, is mostly in the areas of education, service delivery, and surveillance. And so as you go through the Viral Hepatitis Action Plan, and it talks about educating providers or developing curricula, we are doing this in close partnership with CDC and other HHS colleagues. Where CDC has a lot of data and content, we have the networks to disseminate that all across the United States and really, in some cases, globally. So it's really a wonderful partnership, especially if you think about something like the National Health Service Corps, which has far-reaching impact. So the next couple of slides just go through elements of the strategy, and whether it's disseminating the educational material or some of the special projects such as the Hepatitis Initiative or the AIDS Education Training Center telehealth program, these are all innovative programs that we have that we're working on, again, with our HHS colleagues and many of you to implement the recommendations in the action plan. So let me just go to my second to last slide. So what makes what we're doing from the HRSA perspective successful is that it's done in partnership with so many of you, and it's done against a backdrop that is often very challenging. We understand you in your organizations have tightening budgets. We are also imposing different administrative requirements on many of you, and now we're looking ahead, we're all looking ahead together towards a new healthcare environment within the Affordable Care Act context. So amidst these challenges, we face great opportunities. All of the great successes so far from the National HIV/AIDS strategy certainly can inform future successes with implementation of the Viral Hepatitis Action Plan. And what is also exciting is just the widespread recognition throughout the country on the importance of prevention, of integration of education, integration of service delivery and policy development, and how great is it that hepatitis is now on the national radar screen as HIV is. So in summary, there is a lot to celebrate, a lot to be done. Kevin, on behalf of Dr. Wakefield and HRSA, we wish you well on your transatlantic journey. I'm sure we'll Skype you often. And thank you to all of you in the audience for all the work you do every day. So thanks for having me.